Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for ESIC exam preparation. ESIC Nursing Officer exam is on 7th July. We can see questions. First question, which is an isotonic solution among the following? Options. Option A, 3% saline. Option B, half normal saline. Option C, 10% dextrose. Option D, ringer lactate. Based on the tonicity, intravenous solutions or IV solutions are isotonic, hypotonic, hypertonic and colloids. Examples of isotonic solutions include 0.9% NS, that is sodium chloride, and 5% dextrose in water, and 5% dextrose in 0.225% saline, that is 1/4 NS, and ringer lactate. So here isotonic solution among the following isotonic solution is ringer lactate. Option D is the correct answer. And other option, half normal saline. Half normal saline means 0.45% NS. It is an example of hypotonic solution. And first option and option C, 3% saline and 10% dextrose are example of hypertonic solution. Move on to the next question. Monday fever is the other name of options. Option A, asbestosis. Option B, silicosis. Option C, byssinosis. Option D, anthracosis. Monday fever is also known as byssinosis. Option C is the correct answer. Monday fever is also known as brown lung disease, which is caused by cotton dust. And first option, asbestosis, which is caused by asbestos, and silicosis, which is caused by silica dust, and anthracosis is caused by coal dust. It is also known as black lung disease. Black lung disease is anthracosis. Move on to the next question. Appropriate size of endotracheal tube used for an adult is? Options. Option A, 2.5 to 4 mm. Option B, 5 to 7 mm. Option C, 8 to 9.5 mm. Option D, 10 to 12 mm. Our question, E2 size for adult. Okay, and the correct answer here it is 8 to 9.5 mm. That is the correct answer for endotracheal tube used for an adult. Size of endotracheal tube for different age group we can see. It is an important point. For newborn 2.5 to 4 mm. For infants 4 to 4.5 mm. For up to 5 years. Then after infants up to 5 years 5 mm. Then less than 10 years 5 to 7 years. Then that means from 5 years to 10 years 5 to 7 mm. Then after 10 years 7 to 8 mm. Then female adult it is 7.5 to 8 mm. And male adult it is 8 to 8.5 mm. And large adult means for obese patient it is 9 to 10 mm. Here in our option 8 to 9.5 mm is there. So that is the size of, we can choose appropriate or approximate size, that is 8 to 9.5 mm. And the next question, appropriate size of endotracheal tube used for newborn is? This is also one of the previous year question. Option A, 2.5 to 4 mm. Option B, 5 to 7 mm. Option C, 8 to 9.5 mm. Option D, 10 to 12 mm. As we already discussed the different age group, size of endotracheal tube in different age groups. So the correct answer is 2.5 to 4 mm. Option A is the correct answer for newborn. And another one important point, this point was a question which asked in AIMS NOSET exam. ET tube size of newborn, birth weight of 3.5 kg is, and the size of endotracheal tube is 3.5 mm. Okay. Move on to the next question. Normal respiratory rate in newborn is? Options. Option A, 10 to 12 per minute. Option B, 10 to 15 per minute. Option C, 12 to 16 per minute. Option D, 40 to 60 per minute. Our question, a respiratory rate of newborn. It is about 30 to 60 per minute. In our option 40 to 60 is there. So that is the correct answer. Adult respiration is about 16 to 20. Here 12 to 16 is there, 10 to 15 is there, 10 to 12 is there. It is not related to age group. Okay, here normal respiratory rate of newborn is between 30 to 60, and for adult respiration is 16 to 20 per minutes. Move on to the next question. Inflating the urinary catheter balloon prior to seeing urine draining can result in options. Option A, urethral trauma. Option B, dilation of urethra. Option C, infection. Option D, all of this. Catheter balloon tip is inflating before coming the urine. Okay, inflating the urinary catheter balloon prior to seeing urine drainage can result in urethral trauma or urethral injury. Option A is the correct answer. Move on to the next question. Colostomy tube for irrigation of bowel is inserted up to. Options. Option A, 1 to 2 inch. Option B, 3 to 4 inch. Option C, 6 to 8 inch. Option D, 12 to 18 inch. Our question. While doing colostomy irrigation, the colostomy irrigation tube is inserted up to 3 to 4 inches. It should not be insert, or the catheter should not be insert more than 4 inches. And while doing insertion, use soft catheter. Always lubricate the catheter with a water soluble jelly and do not use Vaseline for lubrication. So the colostomy irrigation catheter should be inserted up to 4 inches. So here correct answer is 3 to 4 inches, option B. And another one important point, the amount of colostomy irrigation solution should be 500 to 1000 ml, and the temperature of irrigation solution is 37.8 to 40.6 degrees Celsius or 100 to 105 degree Fahrenheit. This is very important point, the temperature of irrigation solution. And the next question. Which action is most effective in preventing wound infections? Options. Option A, using sterile dressing. Option B, suggesting dietary supplements. Option C, applying antibiotic ointment. Option D, observing careful hand hygiene. Our question is, among the option, which is the most or appropriate effective measures to prevent wound infection? It is hand hygiene. Wash the hands before and after the procedure. Every procedure we are doing that. So wash the hands before doing wound dressing or wound care. So observe careful hand hygiene. Option D is the correct answer. And the next question. For cleaning the pus of wound, which one of the following can use? Options. Option A, H2O. Option B, H2O2. Option C, H2O3. Option D, all of this. For cleaning the pus of a wound, which solution we can use? And the correct answer is hydrogen peroxide. It is H2O2. Move on to the next question. A drain which is used to drainage bile after an open cholecystectomy is. Options. Option A, Hemovac. Option B, Penrose. Option C, T-tube. Option D, all of this. Our question, which type of drainage tube is used to drain bile after cholecystectomy? It is T-tube. Option C is the correct answer. This is also one of the previous year questions. Move on to the next question. Which chemical solution is used for irrigation of bladder? Options. Option A, potassium permanganate. Option B, Lysol. Option C, phenol. Option D, hydrogen peroxide. Question, among the option, which solution is used for irrigation of bladder? The solutions which is used for bladder irrigations include distilled water, normal saline, then 2% boric acid, then potassium permanganate 1 in 10,000, and silver nitrate solution 1 in 5,000, and acetic acid 1 in 400, and 5% glucose solution. Here in our option, potassium permanganate is there. So that is the correct answer. The solution used for bladder irrigation is potassium permanganate. The ratio is 1 in 10,000. And the next question. Which type of catheter is generally used for client with urine retention? Options. Option A, Eckhout. Option B, indwelling urinary catheter. Option C, straight catheter. Option D, three-way catheter. Our question, the type of catheter which is used in a client with urinary retention is indwelling urinary catheter. Option B is the correct answer. And the next question, which vaccine should not be administered to a child with a history of anaphylactic reaction? Options, option A OPV, option B IPV, option C MMR, option D measles. Question, the vaccine which is not given for a child with allergic reaction or any anaphylactic or allergic reaction is injectable polio vaccine. Option B is the correct answer, IPV. And the next question, when was first round pulse polio immunization was started? And our options, option A December 1994, option B December 1995, option C January 1994, option D October 1995. First round pulse polio immunization was started in the year December 1995. Option B is the correct answer. So far we discussed important and previous year questions from previous year question papers. Surely these questions and important points will helpful for your studies. If it is useful for your studies, please share my videos to your friend circle.